All right, you guys ready? Now you get me. Just the
Okay.
just
Can
the
we
two
get
of
all
y'all.
3 years in one session?
Yeah,
Just
we
like
could do this speed.
a routine
Okay,
question.
so here's the deal. I they asked me to break it up younger, middle, and I'm assuming my most popular thing today will be the last session, the perimenopause and menopause.
Everyone
But
wants
anyway,
to know about that.
since it's just y'all, I have slides, but I figure mostly things can be like a Q&A. But this is early years. Let me just go through a couple things, and then if you have like questions, just because it's like being recorded in case anyone says, "Oh, I have the adolescent question."
I went through all the prompts of perimenopause, so now I had hysterectomy. So it's like I need to know the early ones.
Yeah. You're on the other side of it. Okay, my most important thing that I always tell people is like open conversations are the best. We know that from starting at a very young age. It's even more prevalent. They hear things at school. So it's just like a little bit easier, a little bit better. Just start the groundwork at home and make sure they're open and comfortable talking about questions. They're going to blush at first when they ask things, but that's my most like critical advice for the young kids. And then also what we tell our young girls and teenagers, seeing an OBGYN isn't really as scary as they think. I'll talk to you about when you need to see an OBGYN for your child, but it doesn't necessarily mean, oh, yeah, they're going to get a pap smear at age 12. In fact, it doesn't mean that. And so I think kids, teenagers, even 20-year-olds are like, oh my goodness, going to the OBGYN is very intimidating. It's a scary thing. And so it doesn't necessarily have to be that. Okay, so you don't really need your child to see the OBGYN if everything's going fine. You can just see the pediatrician for their well child checkups, the annual checkups. One thing I tell, this is more important for the teenage kids, the vagina is a self-cleaning oven. You don't need any douching, any extra stuff. In fact, just gentle cleansers, usually fragrance free, are the best kind of like yes, come on in, Allie. Are the best cleaning. So people, especially young teenagers, 20-year-olds, they think they've got to do all this extra stuff, and it's just not needed. In fact, it does more harm than good. Some vaginal discharge is normal. I think there's a lot of girls that think that's like, oh, there's something wrong. I've got an infection. If it doesn't have an odor, it doesn't cause itching or irritation, it can be very, very normal. Pap smears we do not do until age 21. We used to do them in teenage years for people that were sexually active, and we even stopped that. And so just through the teenage years, you're in the clear. You can go to the OBGYN if there's issues, but as far as preventative pelvic exams. And then it's so important for the girls to know the wide range of what's normal. I mean, as they start going through puberty, they're going to have some, self-conscious feelings, some body image feelings, and especially with female anatomy, breast development, and then it's kind of weird to say these kind of words in a church building, but with the external female genitalia, the vulva, there is just a wide range of what's normal. And girls can be very self-conscious as they get on and later in life, and it can affect intimacy in their marriage and things like that. And so just letting them know, there's a wide range of what's normal in the female anatomy. Okay, so puberty, we kind of know what's going through puberty. You're probably here because you've got girls that are going to be going through this soon.
This poor girl
But
doesn't,
yes, Julie, you're along for the ride. You're not to this phase.
No, I have a teenage niece that is my twin daughter. My twins.
Oh, so she's practically yours. Yeah.
So I do have questions.
But basically, I would say the average age of when a girl gets her period is 12 in average still.
Okay.
That age tends to seem like it's decreasing, but breast buds, some of these other things can happen. It happens before the period actually starts. Mood changes definitely happen in the years developing. And then cycles are very irregular the first couple of years. Your hormonal axis of your brain talking to your ovaries, and this whole axis is still maturing quite a lot. It takes a few years to do that. And until that happens, cycles, you'll skip months, you'll have 2 periods in 1 month. They're just kind of all over the place.
Wait, can I pause you there? Because that's exactly the question I have. Is it normal to have 2 periods a month for 12 months consistent?
Okay, it's not necessarily normal. I mean, it is normal in the fact that it's very, very common, but there's stuff that we can do about that. So, yeah, a typical period should last 2 to 7 days. It should come about once a month. It's very common to skip months, and that we don't really necessarily have to do anything about, but it becomes problematic when you're having more than one period in a month. And we'll talk a little bit about that. So, oh gosh, microphone. Can you believe I feel like this is like a vintage radio microphone. Okay. Okay, so when things go wrong, this is what we're talking about. So what I already kind of reiterated, a visit to the OBGYN doesn't necessarily mean a pelvic exam. In fact, if you bring in a 14-year-old who's having 2 periods a month, we're probably not going to do a pelvic exam. There might be someone that recommends an ultrasound or whatever, so I don't want to speak for all, but just reassure your child, your teenager before, like, okay, we're going to talk over to the physician, but it doesn't necessarily mean that you're going to have some sort of invasive. In fact, we wouldn't do anything to compromise like their anatomy, as far as like the hymen and things like that are still intact. So irregular periods, like I said, they're very, very common. And oh, look at that, there's no spaces there. But also with increased physical activity, a lot of these girls are doing sports and they're doing, dance and gymnastics. And so those girls tend to have scattered periods. But when the periods become problematic, when they're extremely painful, when you're having 2 periods per month, when they're very heavy, when they're lasting longer than normal, that is part of that axis of hormones still maturing. But that tends to cause problems of missing school because of the pain and the bloating and the nausea and impacting their life as far as moods, and then soaking through their clothes. Yeah. And then, they become very anemic, to be honest. So they're just weak, they're tired, they're fatigued, they can hardly get out of bed. So these problems, although they can, they occur very commonly and they can be somewhat normal, they become problematic. And so usually if that's the case, I do recommend, let me see what I put on that. Okay. I do recommend going on a birth control pill, a low dose. So I hate that they're called that because we use birth control pills. They're really just like hormonal like medications. That is like a very small subset of what they're used for. In fact, they're used, by the dermatologist for acne and complexion. They're used in PCOS, which is a very, very common problem, to kind of regulate and quiet down the ovaries, and they're used to stop huge cyst formation, and they're used for cycle regulation and things like that. And so they're used for so many things in the female realm that, like, the fact that they're called birth control pills. So then, like, there's this stigma of, I'm 15 years old or 17 years old taking birth control pills. So I wish there was a different name for them, but unfortunately they're not named that, but that's like just the overall family of names of what they are. In this day and age, it's a lot different than when even I was growing up. We have very low dose birth control pills that the side effects are, honestly pretty minimal. So the bloating and the nausea that people would get from birth control pills, weight gain, is just kind of null. And so even young girls, age 12, age, 14, they actually tolerate these pills pretty well. So if you have someone that is having periods twice a month, it impacts them. Like, they start to become so anemic, their body just can't keep up with that. Yeah. And so it impacts other aspects of their life. And it's just, when it gets to that point, it's usually time to do something about it.
Is there any studies or stuff that kind of shows the result of getting on birth control pills early versus later, or like?
That's an excellent question.
Or like, how does it affect, like, these later years? Like, are people going into perimenopause earlier? Because
okay.
All that kind of
Not
stuff.
that we know of.
Okay.
In fact, birth control pills have very protective, effects on the ovaries. In other words, like, when your ovaries are ovulating every month, they're just kind of like overworking. So people that have their babies earlier in life and they have more pregnancies, they have a lower risk of ovarian cancer. Well, now a lot of people are getting married later. They're delaying childbirth. We have less kids than we used to, 20, 30 years ago. And so birth control pills, because they kind of quiet down the ovaries and they stop these like hormonal surges, and they actually stop ovulation, they do show some preventative ovarian cancer effects. In other words, the risk of ovarian cancer goes down when you've been on long-term birth control use. It should not impact fertility at all. So when a woman were to stop, if she was on birth control pills for 8 years, let's say, if she were to stop to try to conceive, she should, within the next couple of months, resume normal like cycles, normal ovulation. In fact, sometimes there's like a surgeon ovulation, and you like release a couple eggs. The next cycles after that, you see people that sometimes have multiple pregnancies and stuff after stopping birth control. But it shouldn't have any effects on fertility. In other words, if you were going to have fertility stuff,
or work for like if a young girl is, there's no reason to do the, I don't even know what they're called, IUD, or will that help?
Okay, IUDs are very helpful. So usually we start with oral birth control pills just because it's easy for them to take. Usually young girls like that aren't comfortable like putting anything in the vagina. There's like the NuvaRing and stuff like that, and so usually we just start with we're all hungry. With birth control pills, but the IUD, that's an excellent question. The IUD, well, there's many different ones. The hormonal IUD is a progesterone only method, and it just releases a low dose of progesterone, over a long period of time, and I'm talking years worth of time. And so the advantage of that is you don't have to remember to take a pill every day, all this kind of stuff. But the disadvantage is in a young girl and a teenager, that's kind of hard and invasive to put in. Now, if you're talking somebody in their 20s, even if they haven't had children, it might be a good option. But I wouldn't probably put it in a teenager unless you'd kind of exhausted the other options. They used to just recommend them after you'd had a child, but that's no longer the case, and so they can be placed in women that have never had children, obviously. So,
Laura. I had two questions. So my daughter's almost 14. Her period hasn't come, and I take them manually. And then my pediatrician said, "Don't worry, we will do studies in 4 more years if something doesn't happen." Is that the normal thing? If nothing happens in 4 years, then
yeah.
Or when should I worry?
Yeah. There's a wide range of what's normal, but if by age 16 she doesn't have any like breast buds or anything, then I would probably start, maybe some laboratory evaluation a little bit earlier, like age 16. But
so it's okay to wait. Yeah, because her older sister did have when she was 12, and I have 12 too, and so. But she's worried, and it's like, no, don't worry, you'll be fine. Like
does she have some of the other signs, like breast bud? Does she have any like hair in her?
Yes, everything looks normal.
Okay, then that's very reassuring. But
she is very skinny, and she does a lot of sports, so I hope that's not affected.
So that could be one of the reasons why it's just a delayed period.
Yeah.
But that shouldn't impact her like fertility later when she's married and once kids. It shouldn't have any impact on that. It's very, very common in thin girls that are athletic or into dance and very active to like have a delay in the onset of their periods.
And then my other one, so her cramping does hurt like the first day, and she's very uncomfortable. And then we brought this to a pediatrician too, and she said like it's probably dehydration, which I never related them, but I don't wanted to see if that's something related. Like my girls run anyway, so they said dehydration causes a lot of things, and part of the cramping can be dehydration. So because she needs to hydrate more and do the Advil or whatever. But is there any other? What's the best for cramping or preventing cramping?
Yeah.
That is just
so I mean hydration definitely, but to some degree the uterus is a big muscle. Yeah. And so it cramps just to try to like get that lining to kind of shed off. And if it is intense like that, I usually recommend that they start taking ibuprofen, like maybe if they start feeling that cramping, even before their sign of like before the bleeding starts. But ibuprofen, Motrin, anything in that family, Advil, Motrin, ibuprofen is usually one of the best things for cramping. Midol, that is all one of the best things for cramping.
Midol is good, but it has caffeine. And my daughter doesn't like the caffeine. And
I don't. For my kids, it's like too much on there.
That's what she felt. So, anyways, but I did try it and it did good. I mean, for me.
Yeah, I know. For me, it's great too. But I also need caffeine. But yeah. So the ibuprofen family is the best. Okay. If they are like really, really strong and debilitating, where she's like, "Oh, mom, I can't go to school," that's when I would probably start taking her to the gynecologist to see if there's something additional. I mean, the additional thing they would do would probably be a birth control pill. Heavy periods, or actually more painful periods rather than heavy, can be a sign of things like endometriosis and things like that. But I wouldn't worry too much about that because also like painful periods are just so common in people that don't have endometriosis. In my other slideshow, I have a little bit about endometriosis, but that one is a weird one. People have fertility issues and painful periods. And sometimes when we diagnose it like surgically, sometimes it doesn't match up. The picture doesn't match up. In other words, we see like really bad disease of a ton of endometriosis and their symptoms are mild. And then we have other people that have really severe symptoms and they don't really have a lot of endometriosis. So it doesn't necessarily mean that she's going to have any problems, but
I mean, she takes her pills and she goes like grumpily going, but does her workout, but she's in pain. But it's not like throwing up or like crying or I can see the levels of pain there. So it's hard to know when it's like
when it's
you're
too
not
much.
taking it, but it was too much. But can you do like and she doesn't want to miss working out, like running with the team and whatnot.
And that's the hard thing in the teenage years. They don't want to miss their activities, their extracurricular activities, and the period really can impact that kind of significantly. So that's where if it does become a bigger problem, a low dose pill can really like help transform.
Okay. Do you guys ever use Lycetta kind of stuff in younger girls or no?
What is Lycetta? What is that?
Yeah.
I'm sorry.
It's
She'll explain it better than
we
I would.
do. Did you take Lycetta?
I do. Yes, 100%. It's the best thing that ever happened to me. So.
Okay. Yeah.
But I had that's a whole other conversation. But I've had a lot of different like.
Do you have endometriosis or?
No. So I had hyperplasia, endometrial hyperplasia, and then so we were gonna. But I was under 30. We didn't want to do a hysterectomy. Anyway, did multiple DNCs, and then it went away, and then it came back, and so we did another biopsy.
Okay, Lycetta is not it's another hormonal medication that does. It's not a birth control pill, but it does shift the surges in hormones and works really well for people with endometriosis, heavy bleeding, painful bleeding, and it can be transforming. But yes, we do use it. Do you take it like for 5 days?
Just during my period.
Just during your period, yeah.
So
it just helps.
Because estrogen and progesterone. Because the reason I asked is because Kaylin, but certain hormones make me like I'm a crazy person, and I feel like you guys actually all know me. I feel like I'm pretty like normal.
You're pretty
like psycho on any.
Yeah. So it acts like more in the bleeding pathway, I guess you could say. So it impacts that. In fact, like you really shouldn't take it if you're have any kind of like clotting disorder or anything like that. But
so maybe that's why you wouldn't use it in teenagers. I don't know if it's approved for younger girls, but that's just
it actually can be used. It can be used, and it's a medication you just take for. Do you take it the full 5 days?
No, usually not. Just usually the first couple
you take it for up to 5 days.
I'd rather, like,
so
be on the side of caution,
Yeah, you can. So you don't. It's not like a pill you take every day. You take it. Do you take it 3 times a day or how? Yeah. Okay. So you take it up to 3 times a day, and you can take it for 1, 2, 3 days, up to 5 days, and it just like shortens your bleeding. Does it help your cramping and stuff like that also?
A little bit.
Okay, but it kind of like shortens the period and everything like that. But we can use that.
Times a night, we'll have to get up. So
and change.
Yeah, but my question, I mean with girls because they do get so anxious, right? Like I could see Kaylin being super like she probably won't go to school. Well, I mean I don't know yet.
Oh,
she hasn't started yet.
Same
I know
same with
close.
mine.
I know we're close, and I could see her just no, thank you. And so if light means the bleeding.
Oh yeah, I can tell you my like middle school trauma was all centered around my period. I'm like bleeding through into my shorts and like, do I have a sweatshirt? It's very stressful. So, but that is acceptable to use in teenagers. Yeah, it won't have any long-term effects on their fertility or anything, but that is fine as long as they don't have any. And teenagers aren't smokers, and and they usually are pretty healthy. Kids, and so I don't think they would have any contraindications. Most of them wouldn't, but that is a good option.
What about should they if when they start their period, can they start wearing tampons immediately? Like I was the girl that didn't. Like I did. I wish for years, but then I'm like, I should.
My mom was like,
right away.
Same. I know. I like had.
She's like, because I was super.
You want to do
Yeah, if you're, I was gonna say it's the girls that are in dance and athletics and stuff that are. They have to do them right away. I remember, for me it was like a trip to Schlitterbahn, and Mom's like, "Well, you're either going to Schlitterbahn."
And I did like a balloon thing, and I practice, but even with the balloon and everything, the first one I went is like, I'm sorry, I'm your mom, but I will do it, and you'll get the hint after this. And I put it myself, the first one. Oh my god, the first one.
Yeah.
And she trusted me, but then after that, she just did it, and then we got the.
Yeah, it is. I will say, tampons have come a long way.
They do.
Plastic applicators are way more common. I mean, back in the day with the cardboard and everything, and they have
And I
ultra
didn't do
slim.
it. I didn't do it until pearls came out.
Yeah, they have ultra slim, tampons, but you can. There's no harm in girls using tampons right away. It's not going to do any damage. Yeah. It's just something you do have to talk them through. You know how it is. You have to relax and.
My child's 11. She just turned 11, but I've been trying to prepare her a little bit, like. Because unfortunately, everyone knows that Big Brother has pubic hair. And all, like they all talk about that. Like it's something that they. And so, but I'm like, you're gonna start, But when I tried to talk to her about a period, she like cries. Like it literally traumatizes her a little bit.
But it's so good that you've talked about it because when it happens, she's gonna be more prepared. Okay, this is like.
I'm like,
even though the celebration when it comes, you call me, whatever happens, and we just go and eat out.
That's exactly.
I school the first day I had my period.
Okay, thanks,
This is
Jen.
what we get to do. Like it'll be.
I do think it's important. Those conversations are like, oh, mom, and then but then if it comes in, only dad's home and you're like off, and then she's at least more prepared.
When
I would say I would give her a little.
4 sisters. There was not one piece of stuff in my house.
Yeah.
My dad had to go to the store
and go get it. Bless his heart.
Just get in the bath. You'll be fine.
You'll be fine. I would give her a little, a little like makeup bag kind of thing with a couple like panty liners, maybe a change of underwear in case something happens at school or something like that, just to try to prevent. They can always go to the nurse for that kind of stuff, but it is like there's a lot of an element of embarrassment and stuff like that. For some reason.
What are the signs? Like once they start getting like pubic hair and stuff in girls, like
the biggest sign that you're going to notice is the breast buds first.
Okay. And I feel
I would say when that happens,
but we're a little bit
probably within about a year.
And I've tried to tell her like this year before school started. I'm like, how about we get like a training bra? Like all of that is so traumatic to her. Like she did not want to do it. Finally, she was like, I'm like, would you rather me just bring one home one day? She's like, yeah. Like she couldn't even the thought of even.
I know, and every kid is so different, but I would say most of them fall in that category where there's like a degree of embarrassment.
Because I'm like, I don't want.
And that's why it's so important to talk open dialogue.
And point it out to you. I'd rather you just start.
Get
used to it. But
I know, sometimes you're like, with that shirt, honey, you're gonna have to wear.
I know. But like leg hair is not necessarily.
Not necessarily. Usually, and even like. Axillary, like armpit hair, it takes a little bit of time for that too. I feel like that's not, but the breast buds, you'll notice they might have some pubic hair that you'll notice, and maybe you don't even hardly see down there. Same, and so yeah. So that would be the thing that you're going to see is the breast buds, really. But yeah, tampons, they can use those right away.
But you
and I think that's a big difference. I feel like a lot of us, we use pads forever if we weren't in sports or something that made us do it. All right, any questions, y'all, for the teenage stuff? Well, I'm glad y'all are here.
I was like, PMS is real.
PMS is real.
And I see it now with my kids, like, your period's going to come next week. But I don't tell them that. And then it comes, and they go, pretty sure I just murdered it myself. So that is why I want my daughter to have her period, because I think she cannot release all of this.
I know, I was going to say, sometimes that year leading up to them getting their period, it's just like, you're like, can the period just come? So these, like, hormones, it's like all building up.
There's also a really good book that I'll share, and Liam and Keon have both read. So there's 3 different books. I don't know if you have more, I'll stop.
No, I don't.
Let's see. I'm trying to pull it up so I remember. Because I always like really good. I mean, we have.
It's a book on like puberty.
Yeah. We have really good open like communication in our house too. Like I think there's something about like when there's a physician in the house.
You
like,
might
you talk about stuff that you're like, okay.
And hide those feelings for later. Yeah. And then when they come and ask you something weird like that is uncomfortable, then you're just like, oh, thanks for telling me. But then I go to my cousin like.
I know. All of it.
Okay, so this one.
Because it is more, I mean, it is. Yeah. But then you get used to, I don't know how to
I talk about it, but I think they're like.
I talk about it too much. I'm sure my kids
I think that's kind of the problem. I'm the same. Because I'm like, we're going to.
Okay, if you ever need a third party to talk to them, I'm happy. Sometimes, like, it's easier. In fact, my friend's daughter that's getting married, who I know very well, I was like, you don't want to talk to your mom. You need to come talk to me about your premarital talk.
Oh,
Sometimes you don't. It's easier to not talk to your mom, and it's easier to talk to someone else. But
so for boys, this one's called Guy Stuff, the body book for boys.
Oh, I like that. Yeah.
Guy Stuff, the body book for
Guy
boys.
Stuff.
Okay,
Okay.
I'm gonna write this down.
And I've let Kaylin read it too. Right, like Kaylin and Liam have both.
Yeah, they
Like,
should
looked
read
at
each
both.
other.
Yes,
Yeah.
Yes, they should know what's going on with the other.
It's just got it does have
Environmental
images
for
and like
guys.
even, but it talks about all the changes, everything from skincare to like pubic hair,
Showering, because you're
showering,
gonna need to
like
start
acne.
smelling. Yeah.
Yeah.
Why your feelings, mental health. There's like anyways, I've read through it. I mean, anyways, and then the girl one is
The same author too.
no, the one that we have is American Girl. American Girl. The care of keeping you.
American
yeah.
Girl, the care of keeping you. Does it talk about like
That one,
periods and stuff like that?
Girls will need to shower too, because there's some girls that won't. If you don't shower, everybody needs to shower. That's what the class I need to give. Somebody, my daughter's like, can you come and give the class of showering, because everybody thinks,
oh, maybe
but
it is
people are not showering, but you need to shower.
I know, and
And
deodorant.
it's
They don't
different.
know. Like that's about the time when they're like,
Yeah.
oh,
Yes.
deodorant.
This is the early years in deodorant.
It takes them a couple years to realize, and sometimes when you're closer, you're like, "Oh yeah, you've got to start wearing deodorant." I'm like,
Thank you so much. This was awesome.
Thanks, Mama.
Yeah.
And when does perimenopause? When does it really start?
Yeah,
Okay.
tell us.
Perimenopause is
tell us.
perimenopause is the window of time before menopause, which is the stop of period, and that window of time can be like 10 years.
But how can you?
But
So
how
start
do you
your-
know that you're in it?
40
Yeah.
or
In your
38?
that's not crazy.
It can be 38. I mean, average age of menopause of stopping the periods is like 52. So I would say anytime 40 to 38 can like you could. I mean, some people
And
go
what are
through
the
menopause
signs
at
of that
48.
of perimenopause? I'm sorry, you're gonna have to do another class.
Oh, everything.
Like
Mood
everybody.
changes, depression, decreased libido, hot
Hair
flashes,
falling out.
thinning hair, weight gain,
Literally, lately, when I turn on my
misery.
I just start feeling
Misery.
I'm like, sometimes I'm like, I'm 38. I should know my symptoms by now of what
I know,
is
you're
going
like,
on
how
with my
am I
body. Why else
Yeah.
falling out?
Oh, love you.
you did so good. You did so good.